Hi everyone, welcome to our episode of EducAsian. This month we're focusing on mental health awareness, and I have two very special guests with me today. Please, can you introduce yourselves?
Sure, my name is Trinh, Executive Director of NAMI Southern Nevada. We're a mental health nonprofit that works to educate, support, and advocate for individuals and families affected by mental health conditions.
And my name is Brian Potts. I'm a clinical psychologist by trade. I have a private practice here in the community, also work with a federal agency, and also am a part of the Utah National Guard as an operational psychologist. And I have an opportunity to work with Las Vegas Metro on a volunteer basis, and I'm also on the board of directors of NAMI Southern Nevada.
Thank you. That is fantastic. Thank you for coming. And as a disclaimer, we are all vaccinated and practicing social distancing. So without further ado, let's kind of dive into the topics at hand. I wanted to start off by talking about the importance of mental health. Can you share a little bit of knowledge from your perspective? Why is it important to have a conversation about mental health?
It's not just our physical health, but also our mental health, our spiritual health, our social health, that there's so many different aspects that lead us to our functioning and lead to our quality of life, that it makes it important for us to acknowledge all those different areas, and mental health being one of those areas that lead to how we function and how we just experience our lives on an everyday basis.
Ditto. Very well said. He practically took the words out of my mouth. But yes, just focusing on mental health, it's a part of our whole health.
Right.
So just like how we take care of our dental health by brushing our teeth every day, or hopefully we do, how we take care of our physical health with working out, meditation, self-care, being active in whatever shape or form that is. We have our vision health where we get our eyes checked. Mental health is just another component that we need to make sure that we take care of on a daily basis, not just one time out of the year or when you finally have a mental health challenge. There's ways to prevent, major mental health challenges.
Right. So can I ask why mental health is stigmatized in an Asian household, and what sort of experience do you have with this problem in particular?
Yeah, it's definitely been a taboo subject for a long time, right? I mean, I could only speak to my experiences in
Absolutely.
my household. I just know that growing up, my parents often would tell me, I taught you better than that. There's a lot of emphasis on how we were raised.
Right.
And I think, when someone experiences a mental health challenge, perhaps it might be that there's shame or guilt that's brought onto the family of, your parents should have raised you better.
Right.
But it's not a character flaw. It's not, a character trait that there's an issue with. It's a mental health condition.
Right.
That needs to be treated, and it can impact just anyone, and families aren't to blame.
I think when it comes to, mental health in the Asian community, I'm going to highlight all of the things that Trinh said. I think it is the lack of awareness of really what mental health is, and it being a spectrum. I think oftentimes, I can speak from my own personal experience. My family's understanding of what mental health was severe mental illness, and so they often experienced or had conceptualized mental health as being something that is, a very severe, persistent mental illness, rather than it understanding that there are things like depression, anxiety. I've seen parents not really understand that a child with ADHD is not someone that is lazy or someone that is not trying hard, but rather might be a child that is experiencing ADHD and, with the right support and the right tools can live a great and functioning life. And so I think it is stigmatized in all those factors, and
Right.
it's important for us to talk about.
That's a great answer. Thank you for sharing that. I think even in the Chinese culture, from my personal experience, there's a concept of losing face. So being able to express and to ask for help in that situation sometimes causes the family maybe to lose face. And I think that can sometimes be quite detrimental to a person's mental health. So I wanted to see what sort of actions can people take away from this conversation. Is how can we move forward and say this is necessary for our community? Besides a conversation, what else is there that we can potentially do as allies, as people who are listening, and maybe viewers who are watching this and saying, you know what, I do need to seek this out for myself. Do you have any advice for them?
Yeah. I think when we think about kind of our overall wellness, first, if we are looking at it from a perspective of, this is a part of who I am, and this is something that I'd like to work on, then I think one, like educating the community that it is okay to get help and to seek treatment, to support that wellness. Two, not judging anyone that maybe is going out to get the treatment that they might need. So kind of being supportive within our communities. And three, for me personally, I feel like it's important for us to advocate that like the help is out there and to provide the resources, which is a big mission of what we do in NAMI.
That's fantastic. Thank you. Anything to add, Trinh?
Yeah, just to elaborate on that with the education piece, it's really starting with ourselves, right? Identifying our own emotions, learning how to express that. I know growing up in my household and many of my friends within the Asian culture, Asian households, we weren't really big on expressing our emotions and sharing, those things with each other. So just whether it's reading an article, reading a book, watching a video, it's that self-education, as well as, the language that we use. It's not that we're weak when we're seeking help, because it actually takes a lot of courage.
True.
Imagine how much strength it takes to come out and share that we're struggling.
Right.
It's a scary thought to reach out sometimes and to say, hey, actually I need help. Yeah. And if we are in tune with our emotions and feelings and understand how much that takes to do that, it's actually an act of courage. So the way that we describe and talk about help-seeking behaviors, I think it's going to be a big push towards that.
Wow, thank you for sharing that. I think that is a great reminder to think about how we're listening to our peers and how we're discussing anything really, and that's the way that we're presenting ourselves as an ally to them. How can I help you? Is there anything that we need to be addressing in terms of the language that we use with our family, our friends? And I love that reminder. Can you share just a little bit more about how we can get involved, how we can learn more about what steps to take on our own?
Yeah, we're all about educating the community through our presentations, our education classes. Right. We also have support groups. It's really just getting out there and reaching communities that typically are underserved. We're always looking for volunteers to share their personal stories. Because our organization is a peer-led organization, it's individuals and families that have been personally impacted by mental health challenges and understand mental health conditions from the inside out. Getting them to come out and share their stories about recovery is success, because oftentimes we hear stories about mental health in the news, in the media, in movies, and they're portrayed a certain way, right? That's how they make it to breaking news. But we also want to be able to share what it looks like for someone who's gone through recovery, who's in therapy, gone through treatment, what recovery from PTSD looks like, or depression, anxiety, and be able to share those stories and let people know that it's okay to not be okay.
I think one of the greatest steps is just normalizing this conversation, just being able to seek out people to listen and to talk and to converse about this topic. So what are safe spaces? How do we provide a safe space for the people around us? And why is this important?
First, I think whenever we have a safe space, what a safe space does is it helps us obviously to feel supported. It helps us to feel like we have an area where we can openly communicate and be vulnerable with the people that are in our lives. And so how do we create that safe space? I think first is through communication. Taking the time to acknowledge and to set aside time to specifically talk about some of these things in terms of the support that we offer or the understanding that we'd like to have about that person, and maybe even sharing some of our vulnerabilities with those family members. I think that helps to create that safe space that allows the other person to also be vulnerable with us. So, communication, vulnerability, enduring support, I think all of these things help us to establish that space for the people that are important in our lives.
That's fantastic. Anything to add, Trinh?
Of course, I definitely want to elaborate on that and just say that, with communication, it's really having that space where we can share without judgment.
Right.
So when the other person is just there to listen and not to respond, it's really having, and I'll give an example. I'm the oldest out of 3 younger siblings, so
Right.
there's 4 of us. And in raising my siblings, I kind of felt like I was the mother figure a lot of the times. And they would share things with me, and I would be like, no, this is how it should be done. I'm your older sister, I know better, right? And that's not a safe space. And then over time, what I saw was that they stopped coming to me.
Oh, wow.
They stopped sharing with me things that they were doing, things that they were concerned about, because I was there, in a sense, judging them and telling them what's right from wrong. And I wasn't acknowledging that they're an individual person, that they have their own hopes and dreams and desires and interests, experiences that's led them to whatever point that they were in their lives, whether it meant that they wanted to continue college, whether they wanted to pursue a certain major or whatnot, or, a life career, life choices. And then eventually, once I pulled back and provided a space to say, you know what, I'm here to just listen. And it took years to rebuild that back up, because, I wasn't that safe space for a while. And then once I opened up to them, began sharing with them, asking for some of their support and acknowledging some of their experiences as, it's valid what they're feeling. And just being there to be a soundboard to say, hey, these are my thoughts based off of my experiences.
Right.
Your life is your choice to choose. And I think that was what providing a safe space meant to me, and what I saw, how it played out in my family.
Thank you for sharing that. I wanted to just say a quick thank you so much to our wonderful guests for joining us today. This has been a very special episode on mental health awareness, being that September is, of course, Suicide Prevention Month, as well as the first week of October being Mental Health Awareness Week. So thank you again to Trinh and Dr. Brian for joining us today on ACDC's episode of EducAsian. Thank you.
Thanks for having us.
Thank you for having us.